Okay, so we're going to end the polling and share results. So you can see that 43% of you are very concerned, 31% are concerned, 13% somewhere in between concerned and very concerned. So I think the consensus here is that this is a really important topic, and it's really important to get all the information we can because it is concerning. So without further ado, we can jump into the presentation from Dr. Epstein on the variants.
Hello, and thank you, Emily, for having me today. I'm glad to see that poll and to see that people are thinking about the Delta variant, and hopefully we can talk a little bit more about that today and how the outlook hopefully will be better, but we do need to be careful. So we're going to talk about what a variant is and what a mutation is, why some variants have become problematic for people of this virus. We're going to talk about whether the vaccine still works, which I think is probably one of the top questions on everyone's mind. And then we're going to talk about where we are in the country and in Philadelphia, specifically in terms of cases and variants. Actually going to start kind of from the end of that and just talk about, to start with our infection rates and where we are in terms of infections right now. These graphs are all on our website and show the numbers of people that have been the top one number of people infected with COVID, and then on the bottom row, deaths and hospitalizations due to COVID over the past year and a half. And you can see we've had some big spikes, our initial spike and then our winter and spring spikes. And we came down to the lowest we've really been over the past month. And if you can see right there on the edge, we're starting to creep up a little bit. And that is concerning. The good things are that if you look down at the rows below, the deaths and the hospitalizations, they are really very low and the lowest we've seen during this pandemic. The different colored lines are just different ages. And we can attribute that to all the great work that we've, the vaccination rates in Philadelphia. We have ways to go, but our vaccination teams have done amazing work to get those deaths and hospitalizations to stay low despite this infection rate creeping up. So where are we with vaccination rates in Philadelphia? So about a little over 60% of our of Philadelphians are fully vaccinated, and 73% have had at least one dose. So that's good. We have a ways to go, but that's really good. You can see this broken out by age and race in some of these graphs. You can see the older age groups, we have pretty good vaccination rates, in all races. And the younger group, we have some work. We're working hard to get people vaccinated. And in that smaller graph on the bottom, you can see the younger groups are much less vaccinated than the older groups. So we're working hard to get all of those numbers up now that vaccines are so available. And this is a map of our city and the vaccination rates. And you can see the darker blue areas are where we have higher rates of vaccination, and some of the lighter blue areas are where we still have some work to go to help protect our communities. So back to the main topic of this discussion, what is a variant? What is a mutation? Should we be worried? So a little bit of biology. Viruses replicate only within living cells. So they have to be inside of an animal's body to reproduce, to replicate. Every virus, when it replicates, it makes mistakes. It happens in every virus. And these mistakes are called mutations. Most mutations don't affect how a virus behaves. Viruses with one or more of these mutations are called variants. And there's been many variants of the virus that causes COVID-19 since it was first discovered back in 2019. But the vast majority of these don't change how the virus affects people. So you've probably seen these terminologies talked about, variants of interest, variants of concern, and variants of high consequence. We're really going to focus on the variants of concern, but I'll just briefly kind of go through all of them. So a variant of interest, when a variant first comes onto comes into awareness and seems like it might cause some trouble, it's a variant of interest. These variants may affect COVID transmission, they may affect some testing or treatment, and they can develop immune escape, but usually there's limited prevalence or expansion. They're really not expanding. They're not causing most of the disease. And so these are things that the CDC and the European authorities and worldwide, the WHO keep an eye on, but are not really causing problems generally. Variants of concern are mostly what we'll be talking about. Variants of concern can have an impact on testing, on treatments, and on vaccines. The testing may not be as accurate. There may be increased resistance to therapies, and there may be decreased immunity to disease from previous infection or vaccination. So you may be more likely to get infected after vaccination or previous infection with one of these variants. Most of the ones we've seen have increased transmissibility. That means that's how they become so prevalent so quickly. Most of them actually have not shown to have increased severity. But they could. And the variants of concern in the US right now are the alpha, beta, delta, and gamma. Now, variants of high consequence have clear evidence that prevention measures or medical countermeasures have reduced effectiveness to the virus. That means tests don't work to detect the virus. There could be a reduction in vaccine effectiveness to a high degree. It could mean medications really aren't working to treat the virus, and we have more severe disease and hospitalizations. Luckily, we don't have any of these variants of high consequence. None have been identified by the CDC at this time. So to talk a little bit about what numbers of these variants we're seeing across the country now, the Delta variant is that dark orange bar, and you can see dates down at the bottom. And as of last week, it's predicted that the Delta variant is now over 80% of all COVID nationwide. So it's really transmissible, and it's been taking over all the other variants. It's been surpassing them all. And the little subset here, you can see region 3, which is how the federal government divides regions, and that's the region we're in. It's Pennsylvania, Maryland, West Virginia, and Virginia. And you can see there that the Delta variant isn't quite as high as it is nationwide yet, but it is kind of creeping up and significant. It's about 70% of cases in region 3. Now in Philadelphia, we've seen all the variants. Here we are seeing Delta on the rise, but Alpha is still very much the most prevalent variant. We're just starting to see Delta really come up here, and it's a much smaller proportion of cases as compared to the rest of the country or even the region. And we've had very, very few beta that have been identified. So the most important question, do the vaccines still work? And the answer, luckily, is yes. So all the FDA authorized vaccines prevent severe disease, hospitalization, and deaths very well. And we'll talk about this again some more on the subsequent slides. But we do see people developing COVID, and you've probably heard more and more about breakthrough cases. It is coming up more and more. We're seeing more breakthrough cases, but in Philadelphia, over 90% of hospitalizations and 98% of hospitalizations and over 98% of deaths since January have been in unvaccinated people. So really, we're seeing the vaccines really protect people still. So this is from England. They did a big study and found that the Pfizer vaccine was 88% effective against the Delta variant. And this is just for symptomatic COVID. So not necessarily hospitalization or death, but any symptoms. It was 88% effective after a person was fully vaccinated. But after one dose, it was only 36% effective against the Delta variant. So it's really important to get that second shot if you're getting a 2-dose vaccine. Protection against hospitalization was, again, really effective, 96% after 2 doses, similar to what we've seen here in Philadelphia. After 1 dose, it was still pretty effective, 94%. The Moderna vaccine, since they came out, Moderna's been very similar to Pfizer, so we wouldn't expect anything different. I know there's been a lot of questions about the J&J vaccine recently, and there is still a lot of effectiveness. It still protects really well against hospitalizations and deaths. And the protection was even more than it was seen against some of the more difficult to treat variants such as beta. So just a quick note on why the vaccines still work, because I know we've all seen studies about how antibody levels are decreased, but it's important to remember that our immune responses are really more than just antibody levels. Antibody levels are by far the easiest thing for scientists to test and to research, but we have many other immune cells in our body that protect. And even though some of these studies show that our antibody levels are not coming up to the same levels in the Delta variants, we still think they're working really well, the vaccines. And I think the next slide kind of exhibits that the best. So again, this is in England, and you can see they have their second wave and third wave of COVID mapped out here. Their second wave was in September of last year. Their third wave was in May of this year. And they going down vertically, you're looking at days. So the first row is day 1 of each of those waves, and the last row is day 50 of each of those waves. And then, so the red side is the second wave back before vaccines were available. And you can see on the left side, cases rose quickly in that wave. And on the right side, deaths also rose quickly to 35.9 deaths per 10 million people in the population. And then if you look at the third wave here, you see a very different picture. The cases rose despite vaccination, and they were doing a lot of asymptomatic testing. So, and so these people were tested positive, and the cases rose to really the same level that they did in the second wave. But then if you look at the right side, you see the deaths barely budge really. And that's really a factor of how well the vaccines work. I think this picture really exhibits better than, any other lab study or numbers we can talk about how well these vaccines really are working at preventing severe disease and death. The next question is, will I need a booster shot? And the answer is maybe. Right now, there's no current recommendation for a booster shot, but tomorrow, the Advisory Committee on Immunization Practices is meeting to discuss whether booster shots will be needed. And they'll discuss, probably especially among special populations like the elderly or immunocompromised. It's very possible that they'll recommend booster shots for some groups of people, but not for everybody. And these booster shots could end up being the same vaccine that you received. They may be a new vaccine that targets variants, or there's been studies that show, you can use 2 of the vaccines available to get good responses. So we'll see what they say tomorrow. So what about our kids? Our kids can't get vaccinated yet. It's a scary time. Delta is more transmissible in everyone. It's super, super transmissible, but it doesn't seem to be more dangerous in children. That said, when more children get infected, more children are going to get sick. So really the best way to protect kids is making sure all the adults in their lives are vaccinated. And then this is not really related to what we just talked about, but I did want to bring it up because it's a common question. And I think it's really important to discuss because a lot of people are nervous about these vaccines. And this is a question I get a lot. Do vaccines affect fertility? And the answer is no. So why do people think this? Where did this come from, this idea come from? So someone wrote a letter claiming that there is a similarity between the protein, the spike protein of the virus that causes COVID, which is the protein targeted by the vaccine, and the protein on placental cells called syncytin-1. And these actually are, and the thought was, if the vaccine's going to target this spike protein, it's also going to attack the placental cells. This isn't true. The 2 proteins are actually very different. Dr. Offit, who's works at CHOP, he described it as 2 people both having the number 5 in their social security number and saying, well, those 2 are the same social security number. Those are very different, right? So they're not actually similar. And so there's no basis for this vaccine attacking placental cells. And then we know this in real life because in the placebo-controlled trials that had tens of thousands of people, the same number of people in each arm actually became pregnant. So vaccines didn't enhance fertility and they didn't decrease fertility. They didn't affect fertility at all. The one other note is that this many people around the world has been infected by COVID already, and they produce immune responses that also attack the spike protein. So we would have expected to see a decrease in births around the world, decrease in fertility and births around the world if this vaccine was going to affect fertility, and that just hasn't happened. So fertility is not affected by the vaccine. I think that's actually where I'm leaving you, and I'll answer some questions later on.
Thank you, Dr. Epstein. I'll turn it over to Nicole, who's going to talk about Bounce Back Philly now. And we have a lot of questions coming in, and you can continue to keep asking them throughout the presentation, and we'll answer all the questions at the end.
Okay, hello everyone. My name is Nicole Dancer. I'm the Isolation and Quarantine Program Manager for the Philadelphia Department of Public Health. And today I'm just going to share with you a few of our resources that we have available through our Bounce Back Philly program, our Bounce Back Philly newsletter, and I'm so excited to announce our new program that we'll be launching next Monday, our in-home supports program. Next slide. Okay, so just, we hear these words all the time, but I just wanted to give a little clarity on isolation and quarantine. Isolation, it separates sick people with a contagious disease from people who are not sick, and quarantine separates and it restricts the movement of people who were exposed to a contagious disease to see if they become sick. Next slide. So through our Bounce Back Philly program at the health department, we provide resources and support to people who need to safely separate from their friends and or family when they have been exposed to COVID-19. Next slide. So if you or a household member is unable to isolate or quarantine, our Bounce Back Philly program, we offer a free, safe, and comfortable room in one of our Center City hotels to anyone who cannot safely isolate. Next slide. So a couple of things that we offer at our Bounce Back Philly hotel. Again, this hotel is free. It includes free meals, breakfast, lunch, and dinner, snacks as requested. We have free Wi-Fi, cable TV, and a phone available. We have two clinical nurses on site that provide telehealth support through wellness calls every single day to our guests. And we also work with a provider on site, Gaudentia, that provides 24/7 support for individuals who come who might have mental health needs. They help provide that support. Self-care guidance. We also work with the Department of Behavioral Health through their peer callers, and they call our guests each day towards the evening just to make sure and check on them to see how they can best support them or talk through any mental health concerns that the guests might be experiencing. And this week, we're excited to launch our educational programming, which includes fun activities for our guests. In the beginning, and up until almost this point, the majority of guests who refer to our Bounce Back Philly come from a congregate setting. We also have individuals who come from our contact tracing program. And so we've developed this educational programming for simple, basic things. One programming is how to write a resume. Another one is how to create an email. We have fun with cards. We have one on juggling. And so, and a couple of other ones to provide to our guests, because we realize that it's not just about isolating the individual in a room. We really need to be able to make sure that the entire individual, their mental health is intact as well. We also want to note that every Philadelphian is eligible regardless of immigration status. Next slide. So I'm just going to walk you through our process at the Bounce Back Philly hotel to submit a referral if someone you know has COVID or they need to quarantine. It can be done through our online bit.ly link here, or you can call our phone number listed here between the hours of 8:30 and 6:30 for help. Another resource, you could call the contact tracing line, and then they will make the referral to our temporary housing Bounce Back Philly program. Once the referral is submitted, it goes to our screening team, and they work to complete the referral. And that during that time, they're asking a lot of questions and verifying information. And then it goes to our medical team, which they review it and they approve a person or deny housing. Because we want to make sure that those who come to our Bounce Back Philly hotel are most appropriate guests to be there. So you can't come if you need oxygen or you can't perform your activities of daily living, because the individual, our guests, will be in a room by themselves. So we want to make sure everybody's appropriate to be in a room by themselves. If the person is approved for housing, we work with a company called Catch, and they arrange transportation to our Bounce Back Philly site. Next slide. When the individual arrives, we go through an intake process. So at our site, the items are searched to make sure that the guest is safe and our staff are safe. We also run items through a bed bug machine. It's one of our protocols. And then the guest is escorted to their room, and the intake is completed by a social worker on site. We also have Gaudensi, as I mentioned earlier. They come and they assess the person in person to determine the necessary level of care that they're going to need for their duration of being at the Bounce Back Philly hotel. So what can you expect when you're there? Medical staff are there to perform daily wellness checks. They will call the individual every day just to make sure the person is okay. If there is a concern, the nurse will go up to the room to lay eyes on the person and make an assessment from there. We also have Gaudensia, who's there to provide behavioral health services. And then we have meals, snacks, clothing, and entertainment items that we can provide our guests. The health department and Gaudensi work really closely together to create a discharge plan. And that usually happens on the second day that the guest is at our hotel. Some individuals, they're just going back to their homes. And then we have others who need to be connected to a shelter or to a treatment facility. And we need to make sure that that process starts as soon as possible. And then once the person completes their isolation period or they receive a negative test result, they are discharged from our hotel, and we make arrangements for them to go back to wherever they're going to go next. Next slide. Okay, so I'm sorry, go back one more. Just want to note something about this resource with our Bounce Back Philly program that we have been operating for over a year now, and I know many of you in this call may not have heard about that resource. And so I just want to let you know that we will be accepting referrals to our Bounce Back Philly up until Saturday, July the 31st. And our program at the isolation and quarantine site will be ending on Friday, August the 6th. We will be on a brief hiatus until we identify a new site, until we're able to identify a new site. And unfortunately, you know, right now, the city is open and hotels, they want to go back to normal. They want to open up for tourism. And so now we're working to identify a new site. So brief hiatus for right now. As soon as we identify a new location, I will send this information out to our outreach team, and hopefully that information will get disseminated out to you. Okay, next slide. So I want to share with you another resource that we have through our Bounce Back Philly Creative Corner. And I just want to say I have amazing staff who work each month to bring fresh ideas to our Bounce Back Philly Creative Corner. It's a newsletter designed to keep people engaged and create a sense of community. And we do that to support people during their isolation and quarantine period. Each issue includes personal stories, original artwork, games, activities. And when the slides are sent out, you can check out the newsletter at this bit.ly link found here. And then we also want you to participate. So it's all about word of mouth right now. When we are in need of stories. So if you yourself have experienced COVID, if you know a family member or a story that you want to share COVID related, please, I encourage you to please fill out the form and share your story with us so it has an opportunity to be featured in one of our newsletters. We just kicked off in June. We have June, July, and we have August coming out soon. So you can submit stories, poems. We now have recipes and much more. So please take a look at that when you get a chance. Next slide. Again, to make a referral to our Bounce Back Philly program, this is the bit.ly link, or you can call this number between the hours of 8:30 and 6:30 p.m. Again, our last referral will be on next Saturday, July the 31st, and our operations will end on August the 6th. Next slide. Okay, so I want to talk to you about a program that we are going to be launching on Monday, July the 26th. We know that the most comfortable place for people to safely isolate is in their own home. And while doing the isolation and quarantine site, we've learned that not everyone wants to take advantage of our Bounce Back Philly Hotel. So our in-home supports program was created to bring resources to Philadelphia residents. And what it does is it connects people to social supports and resources to help them safely separate. Who is eligible? Anyone that is a Philadelphia resident who has tested positive for COVID or been exposed. You can reach out to our contact tracing program, and then it will be referred over to our in-home supports program. Some of the supports that we're able to provide will be food and grocery delivery orders. That'll be done through Instacart. And then we also have care packages. Those care packages include K95, surgical masks, hand sanitizers, wipes, disposable thermometers, and a small educational booklet. We hope to offer medication delivery and laundry services soon. We are able to connect people to utility resources and linkages for interpersonal violence and mental health. That's a big one. So these are some of the supports that we have and that we're gearing up to offer Philadelphians. And we hope that this will really serve the community of Philadelphia. And again, please feel free to check out our information, our Bounce Back Philly Hotel, our Creative Corner newsletter, and our in-home supports program. We will also have an in-home supports blog coming soon on the health department website. And so we will make sure that we disseminate that information as well. Next slide. And of course, if you have any questions, please feel free to reach out to me. Thank you.
Thank you, Nicole. That was great. And I think we do have a lot of really great questions coming in, so I want to just jump right into those. Before we do that, I just want to make sure that you're all aware of some resources where you can find additional information. So www.phila.gov/COVID is a great website that has so much information about COVID and a lot of data on it. I saw a few questions about the graphs that we included in the PowerPoint, and all of those graphs came directly from that website. So any questions you have about that, you can find more information on on the website. And then you can also always call our call center. The phone number is 215-685-5488, and they can help with a lot of different services as well, providing you with information, helping you schedule vaccine appointments, any questions that you have about COVID. It's a really great staff that is super knowledgeable about all things related to COVID in Philadelphia. And then I also wanted to make sure that you are all aware of the Homebound vaccination program. So this program is available for any individual who is homebound or for anyone having difficulty being vaccinated at a clinic due to a disability. And personal care attendants, family, and any other caregivers or residents of the individual's household are also eligible to receive the vaccine through this program. So if you're interested, you can call a call center, like I said, or you can call 311, or you can fill out this link if you click that link or use the QR code. So this is a great program that we'd love for you to spread the word about and utilize if you need it. And then I also just want to make you aware of upcoming vaccine events. So there's an event tomorrow. These are vaccine events run by the health department. There are vaccine events happening all over the city right now, but these are the ones that we're running. So tomorrow on July 22nd, there's one at Happy Hollow Rec Center. And then on July 30th, and then all through August, we have our mobile vaccination unit out at different sites throughout the city. And you can find more information about vaccine clinics at our website. You can go to schedule appointments and also find out about walk-up clinics. And then the same is also true for testing events. So I think a lot of people might not be aware that testing is still important, even if you've been vaccinated. If you're experiencing symptoms or you've been exposed to someone and you're nervous, then you should get tested. And we have rapid testing available on the mobile unit. So you'll get your results in 15 minutes. And these are the locations that we'll be at for the month of July. So all of this will go out to you after the meeting, but I wanted to make sure that you're aware of it. So now let me jump into the Q&A. So we have some questions that came in through during the session, and then we also have questions that you all asked when you registered. We'll start with the ones that came in during the session. Shara, I think this first one is for you. Would Abbott and Binac's rapid testing detect the Delta variants?
That's a good question. And yes, they do. So far, none of the variants have evaded our ability to test them.
Great, okay. And then the next question is, do people who get COVID and get a vaccine have more immunity than people who never had COVID but got a vaccine?
That possibly there's some studies that showed that some lab markers of immunity were even higher in people who had COVID and then had the vaccine than were in people who had the vaccine without previously having had COVID. Sorry, even, in all the people who had the vaccine, the levels of immunity surpassed what was needed to prevent, severe disease and death and infection in a lot of cases. Like we talked about, the immune system has a lot of parts that are much harder for us to measure easily. So regardless, get the vaccine, regardless of whether you've had COVID.
Great. And I think, okay, let's see. So do you recommend that vaccinated people quarantine when a household member tests positive?
Right now, no. If you're vaccinated, you don't need to quarantine. It's the vaccines work so well that as long as you're asymptomatic, as long as you don't have any symptoms of COVID, you don't need to quarantine if you're vaccinated.
Great. So then there's a few questions here about kind of how long immunity lasts after someone contracts COVID or one of the variants.
Yeah, so we know immunity, so this antibody immunity seems to last at least 9 months. Remember the vaccines we just started testing a few years ago. We've only had COVID less than a few years ago, a year ago. We've only had COVID for a year and a half. So we think immunity will last longer in most people with healthy immune systems. And again, some of these measures of immunity that are really much harder to test are the ones that stick around longer. So we really expect immunity to stick around for a while in most cases.
Great. Another question here is, are the symptoms of the different variants different from the common symptoms that we know now?
That's a great question. No, so far the variants have shown, pretty well the same symptoms as the previous variants. People who are infected or who are vaccinated and then become infected tend to have much milder symptoms, and of course we've seen that children have milder symptoms usually.
Okay, I'm gonna toss a few your way, Nicole. So what is the turnaround time from the time of a referral to the Bounce Back Philly program to the time that a patient can actually get into the hotel?
Usually, once the referral is made and it goes through the screening process and medical review, it can be the same day turnaround. Its majority is the same day.
Yeah, that's great. And then are college students who reside in Philly during the academic year eligible for Bounce Back Philly program? Is there a proof of residency required for services?
Yeah, if someone lives in Philadelphia, the hotel is for Philadelphia residents. If they're staying here, we have taken in some college students that are in the dorms. They've just given us their address where they're at.
Great. And then does the patient have to give, I assume this would be like a provider, consent to refer them to the Bounce Back program?
Yes. The Bounce Back Philly Hotel, yes, the provider is working with the patient or the guest that's coming, and they're providing that information to us. And yes. And in terms of the in-home supports program that's going to be coming, it's totally opt-in for these services.
Great. Okay, let's see. So there's a few questions here that I'll give to you, Shara, about if the city will implement new restrictions or start requiring masking again if cases go up. So yeah, just a general idea of that.
Yeah, so we're, watching closely the case rates and even more importantly, the hospitalizations and deaths, because with the vaccine, we do see milder cases. We really hope that we don't have to go back to implementing any closures or restrictions. We do highly recommend unvaccinated people wear masks whenever indoors, and vaccinated people can consider it as well as case rates are going up. It certainly doesn't harm anyone, and it could provide some protection. Like I said, we're watching, we're thinking about it, but we definitely hope we don't have to implement any restrictions like that.
Yeah. So I think this is a good question that has come up a few times. I'm fully vaccinated and recently returned to work on an alternate schedule. I'm trying to stay safe because I'm responsible for caring for an elderly parent. Does the mask I'm wearing provide any protection at this point? And I just want to kind of combine that with another question we got when someone registered, talking about teaching in a school for disabled students around, students who aren't able to be vaccinated. And this individual talks about wearing a mask and doing what they can to protect themselves. But just a broader question of, does masking and the additional precautions still protect you?
Yeah, so that's a good question. I think, you've heard about LA re-implementing their mask mandate. The most important thing really is that you've been vaccinated, and that's really so important and really gonna protect you and your elderly parent or your students and your coworkers. That said, when you have these high-risk situations, like you have an elderly parent at home, you might want to implement every protection you can and continue to wear the mask when you're, in indoor situations where that are crowded or you don't know if other people are vaccinated. Makes complete sense, and I don't think anyone would fault you for that.
Mm-hmm. So this is a big question. Do you have any advice for us to give to individuals who are refusing to get the vaccine because they have natural immunity? And I think you touched on this in the presentation, but I think it's something that comes up a lot, so it's probably worth repeating.
Yeah, I think really just encourage people still to get the vaccine. We do see, we do think the vaccine will provide protection even for people who have been infected before. we see breakthrough cases, we see repeat infections, anything's possible, but we still advise it. And I think, you know, the harms of getting a vaccine are really so minimal to the benefit of not getting COVID and not getting severely ill from COVID.
Mm-hmm. Here's another good question. I have a fully vaccinated relative who's had a cough for 1 month now. Should he visit a testing site to ensure it's not COVID-19?
That's a good question. And yes, absolutely. You know, like we talked about, fully vaccinated people are much, much less likely to get COVID. And if they do get COVID, they're much likely to get seriously ill. But it is possible, and it is possible to be symptomatic. So if you're vaccinated and you have symptoms, any of the symptoms of COVID, you should definitely go get tested.
Yeah, and I think that touches on another question someone asked, which is COVID testing free? And yeah, it is. It does depend on where you go. I think there's rapid testing that can cost money, but you should be able to access COVID testing for free. Your best bet would be to go to like a city-run site. So the mobile testing units all offer free testing. You don't need an appointment, and they also offer free rapid testing. And so if you go to our website, I think that's the best place to find free COVID-19 testing sites, to be sure. Okay, let's see. So this was a question that came in through when someone registered, which is how many vaccinations are taking place on a weekly basis?
So I think right now we're at about 15,000 vaccinations a week, which is well less than our high back in March or April. But, you know, we're reaching harder to reach people now, and it takes longer, but we're still really making great progress. And we have lots of opportunities to get vaccinated. So please come if you haven't.
Nicole, this is a question for you. Is eligibility criteria for Bounce Back Philly listed online?
Yes, one thing I forgot to mention is that we have a Bounce Back Philly blog, and I can drop that in the chat. On our blog website, you'll be able to see a YouTube video where it walks you through what the hotel room looks like, what you can expect. We have it available in English and in Spanish. And we also have flyers on eligibility and information that guests would need to know.
Great, thanks, Nicole. Okay, so here's a question. Can children with no symptoms pass it on to grandparents unknowingly?
That's a good question. And a good reason that grandparents should really be vaccinated. Children are much less likely to get infected, much more likely, as you mentioned, to have mild symptoms. They seem to pass it on to family members less often, but it's possible, and it does happen. So really important to get those elderly family members and anyone who's eligible for vaccine vaccinated.
Okay, if someone has had both vaccines and had a bad reaction to the second one, if boosters are recommended, would it be expected that the reaction would be even worse?
There are a variety of reactions, and some of them could be worse, and some of them could be not happen again. It would be important for that person to discuss vaccination with their healthcare provider. Is really the best thing to do. Yeah.
Okay, great. And then, Nicole, there are a few questions about Bounce Back Philly and the dates that you mentioned. So I'm thinking if you just want to send those to me, I can make sure that those go out in the email to everybody because it might be hard to remember.
Sure.
Yeah. And then there was a question about kind of publicizing Bounce Back Philly. And, surprising that people across the city aren't aware of it, which I think is something we've talked about in trying to kind of rename it Bounce Back Philly and make people aware of it. Somehow the word, do you have anything to add on that?
No, it's exactly. In the beginning, the hotel was really for first responders, and then the city saw a need to service underserved populations, those coming from congregate settings. And it really wasn't as publicized as we wanted it to be. And then we also had a smaller hotel at the time where we could only take in about 30 people during the height of the pandemic. And so if we were to publicize it, we would have been overwhelmed. And so when we moved back to the larger hotel that we're at now, we worked to rebrand our whole idea of the hotel through naming it Bounce Back Philly and showing people what they can expect and providing more resources to those who might be interested.
Great, thanks. I think that kind of connects to this question about resuming providing daily case and death counts. I think that we are updating the website every day with death and case counts. And so, again, I would tell you to go to the website and check it out because there's all sorts of really great information. And I think that's a way that we are working to be better at publicizing this kinds of information and making sure that people are aware, because I think there's a lot of people that don't know how much information is out there on the city website. Okay, let's see. We're getting up to 7 o'clock now. We only have 1 minute left. And I think we've gotten through almost all of the questions, but it'll take me a minute to me and everyone else that's here tonight working on the behind the scenes to look through these and make sure that we answered them. I really appreciate everyone attending tonight. So many good questions. And I'm so glad that we were able to host this session on such a timely topic. So I'm going to send an email with all these resources. For those of you who have not yet been vaccinated, we really encourage you to do so, and you can find many places to get the vaccine on our website. And yeah, we hope that you found this informative. Feel free to reach out with any additional questions that you might have. So thank you, everyone. Have a great evening.